the very top of the ladder is snapped. Strapped onto the left ankle.
Just look at your neck, just hold your head still, okay?
Obviously got the deformity to his left ankle. If we don't get this ankle back into the right spot, he could lose his foot.
Yes!
Okay.
There are a number of alarm bells going off.
As Dr. Emma hits the ED floor, her first trauma is on the way.
Trauma when receiving, go ahead. Sure.
3 months pregnant on a motocross.
She says 15 now. Yeah. So 3 months pregnant. Trauma. All right, no worries.
Got a young woman about to arrive via helicopter. She's been involved in motocross riding, but she's also 3 months pregnant, so I'm pretty worried about her. So I'm going to go and get a team ready. And I've just seen Andy. Andy.
Fearing the worst for the pregnant woman, Dr. Emma asks emergency doctor Andrew Tresize to assist.
Yeah.
The badly injured woman has been choppered in from 200 kilometres away.
Whenever I hear about a patient coming who's been involved in a motocross accident, I sort of get butterflies, really, because I've seen horrific injuries related to motocross riding. I hate waiting. And then adding to that is the possibility of injuries to the unborn baby. Hello. Oh, she does look pale. Do you think she's all right? And this is... Hi, I'm Emma. We'll get you across and we'll have a good look and we'll see how things are.
26-year-old motocross rider Sarah was competing in the last race of the day when the accident happened.
On 3, 1, 2, 3.
Go ahead.
All right.
Sarah, who's normally well, she's riding her dirt bike on a motocross track, medium speed, went over a jump 2 metres into the air, landed heavily on the handlebars, rolled a few times, and bystanders describe her as 5 minutes of LOC.
Right.
Husband is unsure whether he witnessed a seizure.
But seizure was brought up.
Yes.
A 5-minute LOC. This young woman has had a LOC. That's a loss of consciousness. The fact that the head has hit the ground at such force that it's caused a seizure, they're both signs that I need to be very, very worried about a possible significant head injury.
So far, right and left upper quadrants are negative.
Yep.
Just getting a pelvic view.
Yep.
Sarah, we just need to get to your tummy to do a quick ultrasound.
Dr. Andrew moves quickly to check Sarah for any internal injuries that could be a danger to her and to her unborn baby.
If Sarah is in the early stages of pregnancy, any blow to the lower tummy, unfortunately, that can sometimes result in miscarriage.
What's that there, the top of the screen?
Someone told me she could be 3 months pregnant,
Yes.
but then she told me she's been trying for 3 months.
So you're not pregnant, darling? No. Okay.
Did you say she's not pregnant?
Not pregnant.
Oh,
that's right.
okay.
So negative fast then.
Yeah.
I'm relieved to hear that Sarah's probably not pregnant. She's actually been trying to get pregnant for 3 months, which is wonderful. So we can actually put our time and effort into figuring out where else she's injured. Sarah, what we're going to plan to do now is just going to finish your ultrasounds.
Yep.
We hopefully in this X-ray get a look at your shoulder.
Yep.
It looks like it's sore. Yeah. You need it? And a sore back. What we're going to do in a minute was going to have a look at your back.
Yep.
And we'll also do a scan of your head. I think your husband said you had a 5-minute loss of consciousness? Yeah. Get ready for a log roll?
Sarah's husband, Leon, was competing at the same motocross event when his young wife crashed.
I was actually out there on the track and she was just laying flat on the ground. And she usually gets up pretty quick and she wasn't getting up.
1, 2, 3.
At first, I thought she was swallowing her tongue, having a bit of a seizure. Yeah, good 5 minutes, I reckon.
Sarah, are you still... Yes,
It's pretty scary riding over to that. There's nothing I want to do for it.
There's a lot of dirt, but not cracked or anything, so that's good. My brother used to do motocross, and I hated it. It's just a high-risk activity, motorbike riding. Motocross can change in a split second. You can sustain a devastating, life-changing injury. That's what I'm worried about for Sarah.
Trauma receiving.
Dr. Tristan's next challenge is arriving.
On my go. We okay?
Oh, dear. It's okay. Okay.
Breathing in. Go. Thank you. All right.
22-year-old farmer Oliver's in agony after falling from the top of a ladder onto his ankle, drastically twisting it. Paramedics have given him the green whistle for his pain.
Oliver, I'm Tristan. I'm one of the doctors. We're going to go through the story. We'll just make sure we got you some more pain relief, okay? At the moment, out of 10, how bad's the pain? 12? 13? Yeah, no worries. Keep using the whistle.
Okay, we'll get a quick handover.
Been standing on the very top of the ladder, it's snapped. He's fallen onto the ground, strapped onto the left hip and ankle. There was some short LAC with a small lump.
It's gonna come. Just look at your neck. Just hold your head still, okay?
Emergency Registrar Dr. Ilya Karailsky immediately checks Oliver for any internal bleeding.
So, press on your belly? No.
So just so everyone's got the same story, he's obviously got the deformity to his left ankle. Fast scan, Ilya?
Fast negative.
We've ruled out any serious internal injuries using the ultrasound. The next priority is to fix the ankle. If we don't get this ankle back into the right spot, there's a chance that he could lose his foot if the blood supply is cut off.
So they'll probably have to put you to sleep a bit and straighten out your legs.
As emergency nurse Eliza Burke prepares Oliver for sedation, she tries to put him at ease.
Is it Oliver or Ollie?
My name's Oliver. I prefer to be called Ollie, but...
Yeah, I'll call you Ollie because my son is called Ollie. Where are you from? Where do you live?
I live with my partner.
Oliver's partner, Bronte, was at home when she heard him scream.
When I ran out, he was lying on the floor. His foot and his ankle were facing the complete opposite way. So I jumped on the phone to an ambulance and he stopped breathing. I really, really panicked. It felt like forever. And we were lucky that when we did the first chest compression, he kind of vomited and came through.
Sorry, mate.
Dr. Tristan's increasingly worried about the blood supply to Oliver's foot.
So let's get some analgesia. We'll reduce the ankle. Ketamine and fentanyl. We need to stretch the joint out, put it back into the right spot, and then set it. If he has lost his blood supply, it is time critical, and we need to get that restored as soon as possible.
With another trauma on the way, emergency doctor Scott Taylor picks up the case.
I have a young female, her name's Joanna. Apparently she's been found this afternoon in an unconscious state of GCS 3.
A young woman is being rushed into emergency after she collapsed at home.
How far off?
5 to 7 minutes.
If I hear somebody's got a GCS of 3 and a headache, we're thinking things like bleeding in the brain, seizures, brain tumours, strokes, brain infections, all nasty things and all things that are life-threatening.
Should be here in a minute.
33-year-old Joanna arrived from Chile just a month ago to chase her dream of studying English.
All right, anything change, guys? Joanna, can you open your eyes for us? Joanna. So we'll go onto the board on 3. 1, 2, 3. Joanna, hello. You're in the hospital. I'm Scott, one of the doctors. Do you have pain anywhere at the moment?
This is Joanna. Complained of a worsening headache over the course of today.
She's stiff. She's really stiff.
You mean meningitis or something?
Yeah. Well, you can't flex her head at all.
Yeah, you're right.
I'm seeing in front of me a patient who's got a really stiff neck that I can't bend. Meningitis is a possibility. Meningitis is an infection of the lining surrounding the brain and the spinal cord. People can get very sick very quickly from it. They can have all sorts of organ failures, so people can die.
When you're happy, can I sit her forward and have a look at her back? I don't see any rash or anything. Yeah, she's so stiff.
I'm not seeing any signs of a rash, so if it's not infection, the next most worrisome thing, it could be a bleed from an aneurysm or a weakening of one of the arteries.
So she was with her friend in the apartment. She asked her friend to get her a pillow. The friend came back with a pillow 2 minutes later and then was unable to rouse her at all. That's where we're at. Any questions?
Do you want to bring the housemaid in? What was your name?
Dariela.
Joanna's housemate, Dariela, managed to call the ambulance despite speaking little English.
Are you from Chile as well?
Yeah.
With all her family in Chile, Joanna doesn't have any loved ones by her side to comfort her.
Working diagnosis, subarachnoid hemorrhage.
Subarachnoid hemorrhage is a bleed on the brain. In most cases, it comes about from a rupture of an aneurysm. You can definitely get brain damage from this, or in most severe cases, die.
Oh, Christ. We'll get her to CT ASAP. We're going to hold off on antibiotics for now. The priority is going to be to try and facilitate the CT first.
Dr. Scott's moving fast to get Chilean student Joanna to the CT scanner after she was found unconscious at home.
Working diagnosis, subarachnoid hemorrhage.
He's worried the 33-year-old has a severe bleed in her brain
CT pretty much ready for her.
that could be catastrophic.
Right, are we good to go? Yeah. Doesn't speak much English, but not really getting any history out of her. 1, 2, 3. So she's really stiff in the neck.
Dr. Scott's alarmed that Joanna's condition is deteriorating
Can we get Reg to have a look at the scan in real time?
and needs radiology registrar Dr. Sebastian Sereden's help
Evening, how are you?
to get an immediate diagnosis, as every second counts.
She's got really significant nuchal rigidity, and she just kind of kept clutching her head in the back of her neck. So I don't know if she's got subarachnoid or she's got encephalitis. Oh, Jesus.
Dr. Scott's worst fears for Joanna are realised.
Oh, no.
We're very clearly seeing that there's blood in and around her brain. So that would suggest that she's probably had an aneurysm that's ruptured. It's awful seeing that. That's a person who's lived a life, who has hopes and dreams, who has friends and family that care very much. We're really worried that things are not going to turn out well.
To me, this seems to only be the ventricle and not really anywhere else.
It was midbrain as well there, wasn't it?
To have any hope of saving Joanna's life, Dr. Sebastian must work out how widespread the bleeding is and exactly where it's coming from.
Maybe some assistance here, even
Yeah.
though there isn't blood lower down here.
Yeah, I'll get neurostats down.
Yeah, sounds good.
I'm just in CT at the moment. We've got a 33-year-old female who's got a head full of intraventricular blood.
We're seeing blood around the brain stem, where we know lots of important brain functions come from, like our breathing. Her conscious state could potentially drop. She might have seizures or stroke-like symptoms. So things kind of have to move fairly quickly from here.
Do you need pain relief there, Sarah?
Yes, please.
Yeah.
Dr. Emma's treating 26-year-old motocross rider Sarah for a potential head injury after she flew off her dirt bike, crashing 2 metres to the ground.
Do you know where you are now?
I think
You're at the Royal Melbourne. And do you know what day it is today?
Sunday.
It's clearly very sore, sort of just over here, isn't it?
Dr. Emma urgently wants to get Sarah to the CT scanner.
Just all sore.
But first, she needs to get her pain under control and x-ray her shoulder.
Can I have a feel of your shoulder? Can you move your arm at all? Can you lift your shoulder?
No, we'll have a look at the x-ray. One of the things I'm really looking for is if she has a dislocated shoulder. We're ready for an x-ray.
X-rays.
But knowing that she's had a whole lot of force through her shoulder, really that force can be transmitted all the way through her entire chest. And so I know there's a high risk of injury internally as well. So it looks in the right spot. It's not dislocated, but they're swollen. No obvious fracture, but clearly very sore.
With no shoulder dislocation, Dr. Emma's increasingly worried that Sarah's pain is masking something sinister.
And you say she did have some chest pain as well then, right side?
She's saying midline. We'll just have a look. Hi, Sarah. I know your shoulder's really sore, but I'm actually more concerned about the force that's been transmitted through your chest. There's a lot of really important organs in there, and underneath it all is her aorta, her major blood vessel running to supply the rest of her body. Anyone that has a huge force injury is at risk of tearing their aorta, and that's a life-threatening injury. Get the scans, does that sound all right?
Yeah.
Good. CT, ready, perfect, great, yep.
But before Sarah can have her CT scan,
Sarah?
it's vital Dr. Emma runs a different kind of test.
I know you're trying to get pregnant. So how long have you been trying?
3 months.
It's possible Sarah may be in the early stages of pregnancy and not even know she's carrying a baby.
I can actually take a sample of your blood and do a pregnancy test. Would that be all right with you? Yeah, and then I'll just, at the same time, I'll talk to you about radiation risk if you were pregnant. So a CT scan exposes the patient and a baby to radiation. And actually it's in very, very early pregnancy where we worry, because that exposure can result in miscarriage and problems with the formation of the baby.
If Sarah is pregnant, she'll face a tough decision whether to go ahead with the much-needed scan or not.
That'll just take a couple of minutes and I'll let you know in a sec.
Hey, it's Scott. Hey, she got a head full of blood.
Dr. Scott and the team are urgently scanning 33-year-old Joanna for a life-threatening bleed in her brain.
Injection, just very still there.
You see anything?
Yeah, left there. Scott, something that's looking sus there.
Dr. Sebastian thinks the blood is coming from a burst blood vessel in the back of her brain.
So I'm going to give ICU a call.
This is worse than what I'd expected. I certainly wasn't expecting to see blood that deep in the brain, where it can potentially cause a blockage that can be life-threatening.
Okay, sure. Spanish, yeah. Do you speak Spanish?
Did a little bit before. Joanna, the medical. ¿Cómo está? Joanna?
The team check to see if Joanna can respond at all.
Joanna, squeeze my hand. Squeeze my hand. Joanna, what's your name? Can you tell me your name? You don't want to get much out of her at all?
I've got nothing other than incomprehensible sound.
We're still concerned about Joanna's conscious state, that there is some injury to her brain as a result of what's happened.
Oh, hey, how's it going?
Joanna's condition is critical. Dr. Scott prepares her for emergency surgery.
We've just got a referral down in Resus 4. She may be for neurosurgical intervention tonight.
Patients with aneurysms that rupture have a wide range of outcomes. Some patients have a full recovery. Some of them, unfortunately, do die. We've done everything that we can in the emergency department. It's up to the other staff in the hospital now to take good care of her. They'll give her every chance.
Just not yet.
Dr. Emma's anxiously waiting for the results of motocross rider Sarah's on-the-spot pregnancy test.
I'll be able to tell you shortly.
To find out whether her much-needed CT scan can go ahead.
Yep, she's negative, so we can go ahead. So, Sarah, that test is not positive. Are you happy to go forward with the scans? Yeah, I think you need them. After that type of fall from the motorbike, I would be getting the scan as well. Yeah, okay, no worries.
As well as a serious head injury,
I'm just going to do a quick brain C-spine.
Dr. Emma's worried Sarah may also have a life-threatening tear to her aorta.
I just get very nervous for the patient. Any kind of injury can occur with your body flying through the air, rolling multiple times. There's high speed, there's high falls.
Husband Leon understands Sarah's passion for the sport.
Oh, well, she's raced all her life on motocross, and we sort of push each other to ride a bit more in that, and her speed sort of scares me a bit, especially when she has a stack. She's had little crashes here and there, but no, this is pretty bad.
Finally, Dr. Emma has some answers.
Right. I'm just having the initial look at Sarah's scan.
What's she done?
I can't see a dislocated shoulder, but she's got a broken rib, the first rib, which is where she saw. So all the force has gone through her shoulder and through that upper chest. Poor thing. Oh.
Dr. Emma's fears are confirmed.
Yeah, she's got a contusion, actually, both sides. So all that is the bruising. A lung contusion means that there's bruising on the lung, so micro-bleeding within the lung. And for Sarah, that's occurred on both sides of her chest. Just want to make sure her aorta is okay.
To find out just how extensive the damage is, Dr. Emma needs the full radiologist's report.
Traumatic aortic injury is devastating and you can die at any moment from this type of injury. View image.
Dr. Emma's keen to get more scan results for 26-year-old motocross rider Sarah, who was knocked out going over a jump.
As I'm waiting for Sarah's CT scans, really I'm thinking of, I don't want to see bruising, bleeding or collection of blood on Sarah's brain. That would be life-altering for her. Beautiful brain. Great news for Sarah. So her CT scan of her brain is normal. So she's got nothing to worry about in terms of a brain injury, particularly given such a huge impact accident. We're off to see Sarah and make sure she's okay. Sorry, Sarah, is that light too bright?
Yeah, it's okay.
Sarah, so your scan of your brain is normal?
Okay.
Which is good.
But Sarah's not out of danger yet. Dr. Emma still needs the report on Sarah's aorta.
How's your pain?
It's creeping up again.
On the right?
Yeah, on my
Shoulder. Yeah. But I can see you've got some bruising on your lungs. So you've had a lot of force go through your chest, sort of across, you know, where your shoulder and then into your chest. I think the second rib at the back is broken, which is where you're sore.
Yeah.
And I think you'll need to stay in hospital under the trauma team at least overnight.
Yeah.
I thought by now she'd learn not to crouch.
Until I get that full report, I can't be reassured that the aorta isn't injured. All right, I'll be back soon. And if you need a tea and coffee, just down there.
Thank you.
No worries. So we need to remain vigilant looking after Sarah while we wait for that report.
If Sarah's chest scans reveal a tear in her aorta, she'll need emergency surgery. Dr. Tristan has to put back into place 22-year-old Oliver's badly dislocated ankle.
Sorry, mate.
Before the blood supply is cut off to his foot.
So what we're going to do is put you to sleep. We're going to put your ankle back in the right spot because at the moment it's facing the wrong way.
The young farmer was 4 metres up a ladder when it snapped, hurtling him to the ground.
Do you have any questions for us?
I'll wake up.
You'll wake up. It's only 10 or 15 minutes. You've got lots of people around you at the moment to make sure it all goes smoothly. Got an 18 gauge in the right forearm.
This will be the first time Dr. Tristan puts an adult ankle back into place.
In children, it's very rare to see a broken ankle and certainly one that's this bad. So this is a new experience to me.
It's going in now, okay?
Nurse Eliza closely watches Oliver as he's given the powerful anaesthetic ketamine.
It makes you feel a bit weird.
Yeah.
You just got to go with it. All right, Ollie.
And you'll probably hold here because I'm just going to need a short, sharp wound. So make a little bit of noise.
Emergency Dr. Bruce Garbett is standing by as Dr. Tristan prepares to pull the ankle back into place.
He's pretty out of it.
Happy? Yeah. Okay.
I'm going to hold on to him.
So it's quite tight, yeah. Ollie's a very strong young man. His muscles are quite tough to work with. He's fighting that. In a child, I would never need to use this much force, but on an adult, it's a whole different ballgame.
With Dr. Tristan struggling...
All right, do you want to come here and just watch him?
Yep.
Dr. Bruce steps in to have a go. Success.
Nice.
Happy? Yep.
It's back into place at last.
Bruce, with his wealth of knowledge, gets it back in straight away. I'm glad it's back in for Ollie. I think that's the most important thing here.
With the worst of the procedure over, Oliver begins to wake up.
You're all right.
I don't even know where I am.
You're at the Royal Melbourne.
Really?
Yeah.
Am I going to die?
No, you're not going to die.
You promise?
Yep.
Thank you.
Yep.
Suddenly, something's wrong.
It's all right, Ollie. It's okay.
What if they kill me?
So Ollie has developed a terrible sense of doom, which can happen with ketamine. To Ollie, these feelings and sensations are completely real. Stop. It's all right, Ollie, it's okay. Just pull the side of the bed up. Ollie's a big guy. He's really, really strong. Yes! It's all right, mate. It's all right, Ollie. Ollie. And there are a number of alarm bells going off for us.
This is the worst ketamine reaction I've seen.
He might fall off the trolley, he might disrupt the fracture. People can become quite physically aggressive.
Nurse Eliza's working hard to calm 22-year-old Oliver.
Ollie? Yes! It's all right, mate. It's all right, Ollie.
The young farmer's having a bad reaction to the anaesthetic drug ketamine that was used before they pulled his ankle back into place.
You just look upward. Look up and put your head back. Good boy.
Most patients tend to wake up slowly and don't get this agitated, so this is concerning and it makes me much more worried about a nasty head injury.
Oliver urgently needs to go for a CT scan.
Just pop your head down.
It's all right, Ollie.
But right now, he's too distressed to be moved.
Listen. Look up at the ceiling. Look. Okay, hold my hand. That's it.
I'm scared.
He's terrified, stuck in between reality and unconsciousness. That's it. Everything is perfectly fine. It's just a side effect of the medication. I think it's important to bring him back out of this dreamlike state. And that might be just holding someone's hand, getting them to take a deep breath. There's no drug or anything you can find that replaces the comfort that you can get from another human being. You did well. I'm going to let go of your hand for a second. He's better now. We are going to take you to the CT scanner. I'm going to come with you.
As Oliver calms down, the team move quickly to get him to the CT scanner. But as they wait to go in, Oliver still has only one thing on his mind.
Promise I won't die?
Promise. You're safe. You're very safe here, eh?
The paediatrician came out in Tristan when he offered him his pinky to make a promise that he wasn't going to die. So that was very cute. And I think we probably need to do that more in adult emergency.
I thought I died and I didn't want to lose my girlfriend. I love her so much.
Oh, that's really sweet. Okay. Just listen to what they say and stay still.
Yeah, well, sweet.
Oliver met his girlfriend Bronte at a Bachelor and Spinsters ball 2 years ago.
I love how caring he is. He's very old-fashioned. He'll go and open the car door for me always. I don't think I ever want to do life without him.
Got a visitor.
Hello.
So we come back from the CT scanner and there is beautiful Bronte and his mum.
I thought I died.
And that must be like a dream come true for Ollie, who's been just terrified.
Dr. Tristan now has some initial CT results.
So just going down, got one of the bones coming down through the leg and into his ankle. And we can see he's got a nasty break that goes right through, which is why the dislocation was tricky to put back in place. Can't see any significant brain injuries. He's been incredibly lucky. When Ollie fell, the ladders collapsed and he's landed on his feet, which is why he's had such a nasty ankle injury. But that's probably saved him from having a brain injury. Guys, I'm Tristan. I'm one of the doctors. We've been looking after Ollie. He had a nasty break and dislocation of his ankle. We've just done a scan from basically head to toe to look at other injuries. So we're waiting for the formal scans to come back. The radiology doctors will go through, but so far that looks like his only injury. That's good. Yeah, so we'll keep him in hospital because he'll probably need an operation to fix the foot. Yeah.
No worries, thank you.
Good. Any questions at the moment? Excellent, thank you.
Oliver's now heading to the ward where he'll be prepped for ankle surgery. Emergency doctor Maya Cubit is enjoying a bit of downtime as she walks the final stretch into work.
I'm listening to some drum and bass. It's a good way to contain your brain for a bit. So one of the real problems with my role is there's a real tension between being a human being and showing yourself as being a bit vulnerable. Anything could be happening in my world at home. Like, I've got 3 children, I've got animals, I've got my family of my own. So I'm a real person with real things, and sometimes I find it harder to contain those things going on in my world. But the tension, of course, is that my job is to lead a team, and I do take that very seriously. And some days I have bad days. The days that I count as very good days are the ones where I'm a really good role model.
Hey, Maya, would you like to see a 103-year-old sepsis? They'll be in recess 1 in about 10-ish minutes.
Yep, no problems.
Thanks.
World War II veteran Leslie has been rushed into ED with complications.
Hello.
Hello. I'm Pip, one of the nurses.
After breaking his leg following a fall 6 weeks ago.
This is the fun bit. Slide on over.
Oh, Leslie, you look super uncomfortable there, my friend. I'm Maya. I'm one of the doctors. Nice to meet you. I'm going to get you a pillow. I'm known in the emergency department as somebody who likes to work with older patients. Oh, here we go. They are very wise members of our community who've often given a lot in really interesting ways. From a medical point of view, they're often the most complex and the most challenging in terms of unpicking all the threads and figuring out what it is that is needed for them.
Leslie is a 103-year-old gentleman. When we've arrived, he's been a fair bit more unwell than described. Known to have infection at the surgical site to his right thigh.
Leslie's leg has become infected following an operation to fix his broken thigh bone.
Thanks very much, guys. I think Leslie was giving you a thumbs up.
Leslie's legend.
Leslie, would you mind if we help take these off? I want to have a look at that infection in your leg. Leslie has all of the hallmarks of what we call sepsis. Is it sore? Let's have a look. His blood pressure is very low, his heart rate is very high, his temperature is very high, and that's all because of an overwhelming infection where your body systems are failing. Oh, yeah. Is it sore in there?
It's a bit sore,
Yeah. This is a time-critical, life-threatening situation. We probably need to upgrade the antibiotics. I'm just going to swab that leg.
Les, a couple of silly questions.
Probably going to give you a silly answer.
Oh.
Emergency nurse Pip Harrison makes sure Leslie understands what's happening.
Do you know where you are at the moment?
Yes, I'm at the Royal Melbourne Hospital.
What year are we in?
The usual cat.
There's this really funny phenomenon in emergency departments where the people that you meet that would be justified in being the most upset, the most frightened, are the people who are most upbeat, most grateful, with a kind of resilience and humour that I really admire. Might just try and ring the surgeon. Oh, hi, my name is Maya. I'm an emergency physician at the Royal Melbourne.
To work out the next steps, Dr. Maya calls the surgeon who operated on Leslie's leg.
Okay, we're going to get into some trouble here, I think. Thanks for... Bye. So he's had multiple different fractures in that femur, so the bone that goes from your hip down to your knee, and then he's fractured below that, and so then the other surgeons had to go in and put some more plates. So he's essentially got an entire leg full of metalware, which is a problem when you start to get infections like this, because the infection gets quite deep and they can be really, really difficult to treat. Leslie, I'm going to bring you into hospital here, OK? Try and get this infection under control, all right?
I got plenty of time. Time's no effort to me.
So the next sort of short-term plan for Leslie is to get some pictures of his leg and to see the infection and to see the metalware and to figure out what it is we're actually dealing with. Leslie's in a lot of trouble and he's got a very high risk of dying.
Dr. Myers looking after 103-year-old Leslie, who's suffering from a life-threatening condition called sepsis.
I've taken a swab. I'm just going to put a dressing back on.
The war veteran needs an X-ray immediately to find out if the infection in his leg can be treated.
The thing that will determine whether or not Leslie survives this infection is whether we can control the large collection of pus that he's got in his leg.
Hey, Leslie, how did you break your leg?
Very easily.
Yeah?
I'd washed my hands, stepped out of the washroom, and got hold of the sliding door which I thought would be solid, and it slid away beautifully.
Huh.
And down I went like a ton of bricks.
Oh, no. We'll get some pictures and see how deep that infection goes. Is there anybody that you want us to let know that you're here?
Well, I think my daughter...
All right, I'll give her a ring. Oh, hi, Janine. My name is Maya. I've got your dad here, Leslie.
Leslie had plans to spend his last years living with his daughter Janine.
We're all going to live together in this retirement village, a lovely life, and Dad unfortunately had a fall.
Restricted blood pressure.
We're looking forward to Dad coming home. He's going to enjoy watching the cricket because he just adores cricket, and he's going to have his 104th birthday on the 31st of January. So things are going to be really great.
Before going to have his scans, Leslie shares his secret to a happy life.
You got to have fun. No good you worrying about what's going to happen next. See? Yeah, I've had a good life.
Leslie's now on his way to have the critical X-ray that will determine his chances of survival.
Big breath in, hold your breath. We're all done with the X-ray. You relax.
Oh, thank you.
Now we go back to the room.
And I hope that they find this infection and clean it up, and I'll soon get back on my feet again. That's what I hope.
Dr. Meyer now has Leslie's results.
So you can see his leg full of metal. Can you see there's this sort of dense grey stuff versus that, and there's these black holes in there. So there's air and pus in that part of his leg. So that's a real bugger, and it sits around all the metalware. That's really tricky for Les.
We're just giving you antibiotics in your drip. All right, beautiful.
This is a really life-threatening situation for Leslie. The things that we need to do to fix overwhelming sepsis includes having an operation. But the likelihood of him surviving that surgery is very low. Leslie gets to decide what matters to him, and on the advice of the team around him about what is the most achievable outcome. And once he's got a good picture of that, make a decision, a really tough decision.
26-year-old motocross racer Sarah was choppered to the ED after she crashed her bike going over a jump.
Landed heavily on the handlebars.
Dr. Emma feared Sarah could have significant head and chest injuries.
So to do a quick brain CSI.
Sarah's brain scan was clear.
She's got a contusion both sides.
But her chest X-ray did show severe bruising to her lungs.
Just want to make sure her aorta is okay.
Feel better.
Sarah was finally given the all clear and returned home the next day with only ligament damage to her shoulder. 3 months later, Sarah's shoulder has fully healed and she's back on the bike with husband Leon right beside her. 22-year-old farmer Oliver was in agony with a severely dislocated ankle after a ladder collapsed underneath him.
We're going to put your ankle back in the right spot, because at the moment it's facing the wrong way.
Yeah. Dr. Tristan and the team finally managed to put the ankle back into position. But Oliver suffered terrifying hallucinations.
It's all right, Oliver.
As he woke up from the anaesthetic.
It's all right, mate. It's all right.
Three months later, Oliver's still recovering.
So here is the scar from when I had the surgery.
If I just stick with my exercises, I should be able to get full movement back. Oh, thank you.
The ice is melting.
Oliver's devoted girlfriend Bronte has been his greatest support.
I've been so thankful for everything that she has done for me while I've been injured, and she's been so caring.
And the TLC is working. Oliver's gradually returning to the farm work he loves.
I'm actually starting to manage to do more because I can walk a little bit. I'm very happy to be outdoors and doing something.
103-year-old Leslie was recovering from a badly broken leg when he came into the ED with a life-threatening infection.
Is it sore in there?
It's a bit sore,
Yeah.
Dr. Meyer worried that Leslie may not survive.
We're going to get into some trouble here, I think.
X-rays revealed that Leslie needed an operation, but the risks were high.
That's really tricky for Les.
I've got the book here that we've made for Dad.
Give me a look.
Yeah.
It's fantastic.
Sadly, 3 weeks later, Leslie passed away peacefully, surrounded by his daughter Janine and son Peter.
Dad was quite understanding that it was his time. And he said, I'm very proud of you children, but I think I'm going to ruin your Christmas. He just left us beautifully. There's the kids telling the knock-knock jokes.
Oh, that's right.
He made the best of everything, and we're just so glad that we had him in our life.
Joanna, can you open your eyes for us?
33-year-old Chilean student Joanna was rushed into the ED after she was found unconscious.
She's really stiff.
Dr. Scott's worst fears were realised
Oh, no.
when they discovered a burst aneurysm in her brain.
Got a head full of blood.
Neurosurgeons tried to save her life with an emergency operation.
We're really worried that things are not going to turn out well.
10 days after surgery, Joanna's well on the road to recovery.
Te quiero, te amo.
With her mum Nalida making the long journey from Chile to be with her.
If your mom is with you, you're in peace.
Two months later, Joanna's enjoying her last days in Melbourne before returning home to her family in Chile.
I feel so lucky. And now I feel I have a new opportunity to live. I want to appreciate that. I want to say to the doctors and nurse, thank you a lot, because you saved my life. Yeah, I'm so grateful.